Good afternoon. Today we're going to cover Chapter 4, Nail Structure, Disorders, and Diseases. There are 6 objectives to this chapter. Objective number 1, explain why you should learn about nail structure, disorders, and diseases. Number 2, define the natural nail unit. Number 3, label the structure of the nail. 4, describe the factors that affect nail growth. 5, identify unhealthy conditions of the nail. And 6, outline the scope of practice for your license related to nail structure, disorders, and diseases. So let's break down objective number 1. Explain why you should learn about the nail structure, disorders, and diseases. To perform professional and responsible services and care, you need to learn not only about the structure and growth of the nail, but you must also identify when it is safe to work on a client. Having a thorough grasp of nail structure and growth allows you to expertly groom and beautify nails. This knowledge often prepares you for more advanced nail services. Nail technicians must be able to differentiate between healthy and unhealthy conditions on a client's nails for several reasons. First, you must be able to identify conditions that should not be treated in the salon. Second, you need to take the appropriate steps to protect yourself and your clients from the spread of disease. Finally, you could be in a position to see conditions that may signal mild or serious health problems that require the attention of a doctor. The natural nail is the hard protective plate that protects the tips of the fingers and toes. It is an appendage of the skin and is part of the integumentary system. The nail plates protect the tips of the fingers and toes. Their appearance can reflect the general health of the body. Understanding the structure and growth of natural nails allows you to, again, expertly groom, strengthen, and beautify nails. You may also offer clients guidance on maintaining healthy nails and proper home nail care. It is important to know the difference between the nail cuticle and the eponychium before you perform nail services, and understanding the structure and growth cycles of the natural nail will prepare you for more advanced nail services. Objective number 2, define the natural nail unit. The natural nail unit is made up of several major parts, including the nail bed, matrix, nail plate, cuticle, eponychium, hyponychium, specialized ligaments, and nail folds. All of the parts of the finger from the tip of the first knuckle are referred to as the natural nail unit. The natural nail itself is technically referred to as the onyx. You need to make sure that you understand and know the term for the natural nail, again, which is the onyx. It is composed mainly of keratin, which is the fiber-shaped protein found in the skin and hair. A normal, healthy nail is firm and flexible, it's shiny and slightly pink in its color. Its surface is smooth and unspotted. There will be no splits or deep grooves. A healthy nail will be whitish and translucent in appearance, with the pinkish or beige color of the nail bed showing through. Objective 3, label the structure of the nail. The natural nail is divided into several major parts. Each of these parts forms the natural nail unit. So we're going to break each of these parts down over the next few slides. Starting with the nail folds. So the nail folds are folds of normal skin that surround the nail plate. These folds form the nail groove on each side of the nail. The lateral nail fold, also known as the sidewall, is the fold of skin overlapping the side of the nail. As you can see here on the screen, we do have the proximal nail fold that is visible, but again, on the side of each fingernail, you also have sidewalls, which are also nail folds as well. The proximal nail fold is the entire flap of skin covering the matrix. Extending from the edge of the visible nail plate, to the first joint of the finger. This tissue folds back underneath itself to create a flap of tissue that shields and protects this sensitive area. So again, the proximal nail fold covers the entire matrix, which we will learn about the matrix here in just a second. The nail plate is the hardened keratin plate that sits on the top of the nail bed. It is the most visible and functional part of the nail unit. It is formed by the matrix cells, whose sole job is to create nail plate cells. While it may appear to be one solid piece, the nail plate is constructed of multiple layers of nail cells. As it grows, the nail plate slowly slides across the nail bed. The free edge is part of the nail plate that extends over the tip of the finger or the toe. The nail plate is relatively porous to water, which means that it can absorb moisture. The water content of the nail is related to the relative humidity of the surrounding environment. A healthy nail may look dry and hard, but has a water content of between 15 and 25%. You want to make sure that you note that. So the water content of the nail plate is about 15 to 25%. The water content directly affects the nail's flexibility. Next, we have the nail bed, and the nail bed is a portion of living skin that supports the nail plate as it grows towards the free edge. Because it is richly supplied with blood vessels, the area under the nail plate can have a pinkish appearance in the area that extends from the lanula to the area just before the free edge of the nail. The nail bed contains many nerves and is attached to the nail plate by a thin layer of tissue called the bed epithelium. The bed epithelium helps guide the nail plate along the nail bed as it grows, so be sure to add that to your notes. The bed epithelium is a thin piece of connective tissue that helps guide the nail plate across the nail bed as it grows. The matrix is the area where the nail plate cells are formed and extends from under the nail fold at the base of the nail plate. The matrix area contains nerves, lymph, and blood vessels to nourish the matrix cells. Make sure that you add the purpose of the matrix to your notes. So again, it contains nerves, lymph, and blood vessels to nourish the matrix cells. As long as it is nourished and kept in a healthy condition, the matrix will continue to create new nail plate cells. The visible part of the matrix that extends from underneath the living skin is called the lanula. It is the whitish half-moon shape underneath the base of the nail plate. So if you're trying to identify the lanula on your own fingers, you may not be able to see it on each finger. However, each finger does have one, and it is that white half-moon shaped portion of the nail structure. The growth of the nail plate can be affected if an individual is in poor health, if there is a nail disorder or disease present, or if there has been injury to the matrix, such as maybe slamming your finger in the door, getting into an accident that damages or smashes your finger in the matrix. The next portion of the nail structure is the cuticle. It's important to note that the cuticle is non-living. It is colorless tissue that's attached to the nail plate that comes from the eponychium located on the underside of the skin lying above the natural nail plate. The cuticle becomes strongly adhered to the nail plate while still underneath the proximal nail fold and pulls away and adheres to the upper surface of the nail plate as it grows outward. The cuticle forms an important seal between the proximal nail fold and the nail plate, preventing infectious organisms from getting underneath the skin to infect the matrix or the bone. So again, the cuticle is non-living tissue. We actually, this is the portion of the nail structure that we push back when we are preparing for our nail enhancements and nail services. The eponychium is the living skin underneath the proximal nail fold at the base of the nail plate covering the matrix area. The eponychium is often mistaken as the cuticle. Do not make that mistake because the eponychium is living skin. They are not the same. The cuticle is the dead tissue adhered to the nail plate. The eponychium is the underside of the proximal nail fold and is the living tissue that makes the cuticle. The cuticle becomes eponychium, which is found on the underside of the proximal nail fold. So, determining the difference between the cuticle and the eponychium is easy when you go through this simple checklist. So, ask yourself, is the tissue adhering directly to the nail plate but easily removed with gentle scraping? Is the tissue very thin and colorless but easily visible under close inspection? Is the tissue non-living and not directly attached to living skin? If you answered yes to any of these questions above, then the tissue is called the cuticle. Another question that you may ask yourself is, does the tissue cover the nail plate and the nail matrix except the lanula? If you cut deep enough into this tissue, will it bleed? If you answer yes to any of those two questions, then the tissue is called the proximal nail fold, which is living skin. Nail technicians can gently push the proximal nail fold back, but are prohibited from cutting or trimming any living skin, which includes the proximal nail fold. Even if the skin appears dry and hardened, it is part of the living proximal nail fold. Cutting any part of the proximal nail fold or other living skin is outside of the scope of a nail technician and not allowed under any circumstances. Next, we have the hyponychium. The hyponychium is the slightly thickened layer of skin that lies between the fingertip and the free edge of the nail plate. It forms a protective barrier that prevents microorganisms from invading and infecting the nail bed. Treat this area gently because when it is damaged, the nail plate can separate from the nail bed, making infections under the nail plate possible. And lastly, we have specialized ligaments. So a ligament is a tough band of fibrous tissue that connects bones or holds an organ in place. Specialized ligaments attach the nail bed and matrix bed to the underlying bone. Objective 4. Describe the factors that affect nail growth. The growth of the nail plate is affected by nutrition, exercise, and a person's general health. Normal, healthy nail plates can grow in a variety of shapes depending on the shape of the matrix. Remember, the matrix is responsible for the production of the cells that create the nail plate. The length, width, and curvature of the matrix determines the thickness, the width, and the curvature of the nail plate. For example, a longer matrix produces a thicker nail, and a highly curved matrix creates a highly curved free edge. Nothing can make the nail plate grow thicker. This will require the size of the matrix to grow larger. However, regular manicures, good nutrition, and keeping the cuticles moisturized help in maintaining healthy nails. The average rate of nail plate growth in the normal adult is about 1/10 to 1/8 of an inch per month. Nail plates grow faster in the summer than they do in the winter. Children's nails grow more rapidly, while elderly people's grow at a slower rate. The nail of the middle finger grows the fastest, and the thumbnail grows the slowest. So I do encourage you to make notes about those things that I just mentioned. The average rate of nail growth per month is 1/10 to 1/8 per inch per month. Children's nails grow faster than adults. Our nails grow fastest on the middle finger and slowest on the thumb. Nail plate malformation. So the plate will continue to grow as the matrix is healthy and undamaged. However, The shape or thickness of the nail plate can change because of damage or infection to the matrix. Ordinarily, complete replacement of the nail plate takes about 4 to 6 months. Toenail plates can take anywhere from 9 months to 1 year to fully be replaced. Each time a new cell is created, it pushes the previously created cells upward and away from the matrix. This causes the plate to flow slowly towards the free edge, but only as quickly as new cells are produced. If nail cells are produced faster, the plate will grow more quickly. The reverse is also true. If a small portion of matrix cells stop making new cells, the nail plate will become thinner and develop a narrow groove. As a normal part of the aging process, parts of the nail matrix begin to permanently slow down production, causing the plate to develop a series of narrow grooves running down the length of the nail plate. These grooves are often mistaken for ridges. The matrix does not grow any ridges in the nail plate, only grooves. Never file these so-called ridges, as this will thin and weaken the entire nail plate. You can buff the grooves to smooth them out or give them a smoother appearance. Objective number 5, identifying unhealthy conditions of the nail. I first want to highlight the scope of practice. So I want you to be reminded that you are not to diagnose, treat, or prescribe any clients. We are only here to be able to identify unhealthy conditions. And if you assume that someone has an unhealthy condition, your responsibility is to refer them to a physician and get written permission to perform the services. Many nail disorders derive from hereditary injuries or disease. If you suspect that a client has a nail disorder, inform them and refer them to a physician. Your job is to mainly improve the appearance if it is a cosmetic situation. So let's break down a few of these nail disorders. We're going to start with what a nail disorder is. So it is an unhealthy condition of the nail that is either hereditary or caused by injury or disease to the nail unit. You may be able to help your clients with nail disorders in one of two ways. You can tell them that you have observed what may be an unhealthy condition and refer them to a physician. Alternatively, you can improve the appearance of certain conditions if the problem is cosmetic and not a medical condition or disorder. Again, it is your responsibility to and a requirement of your license to know which option to choose. Let's start with Bowes lines. So if you're following along with your textbook, you'll be able to see table 4-1 that starts on page 105 and it goes all the way through 107. So we're going to break down each disorder, starting with Bowes lines. So on the top left of the screen, that is a definition or a picture example of Bowes lines. And so you do need to write down the characteristics of each disorder because you are expected to know these, identify these, and you will need to know these in order to be successful as a nail technician as well as getting your license. So Bowes lines. Bowes lines are depressions running across the width of the nail plate due to the slowing production of matrix cells, which causes the nail plate to grow thinner, usually the result of illness or injury. So Bowes lines are depressions that run across the width of the nail plate. Next, we have a bruised nail bed. So as you can see in the picture, it's characterized by dark purplish spots usually due to a small injury to the nail bed. This condition can usually be covered with nail polish or camouflaged with an opaque nail enhancement product. So a bruised nail is something that you can enhance in the nail salon. Next, we have discolored nails. So nails turn a variety of colors. It may be due to surface staining. Maybe they decided to apply hair color or work with some type of pigment without wearing gloves and stain their nails. Or it could also be a systemic disorder or poor blood circulation. And in the middle, we have an eggshell nail. Eggshell nails are noticeably thin, though the nail plate is more flexible than normal. And this is usually caused by an improper diet, possibly heredity, possibly an internal disease, medication, or from a nail tech by overfiling with an abrasive. Your clients may also come in with hangnails. The proper term for a hangnail, we call them an ag nail. And the sign or symptoms are damaged skin around the nail plate, often on the eponychium, and it becomes split or torn. Hangnails can be carefully trimmed, provided the living skin is not cut or torn in the process. To the top left, we have an example of an infected finger. So an infected finger is characterized by visible redness, pain, swelling, broken skin, or pus. If you come across infected nail fingers, you should refuse a nail service, and medical referral is required. Next, we have leukonychia, which is at the top right. I do encourage you to look up another picture example of leukonychia. Leukonychia is characterized by white spots of discoloration of the nails, usually caused by minor injury to the nail matrix. Maybe your client hit their hand on a desk or something like that. They often appear in the nails but do not indicate any type of disease, and they usually will disappear as the nails grow out. Next, on the bottom left, we have melanonychia. So melanonychia is a significant darkening of the fingernails or toenails caused by increased pigment or increased pigment cells, which are melanocytes. It's visible as either a black band extending from the base to the free edge or may affect the entire nail plate. This one's fairly common in African Americans and Asians. However, in Caucasians, it could be an indicator of disease. In the middle, we have nail psoriasis. Nail psoriasis is characterized by nail surface pitting or roughness, onycholysis, and bed discolorations, either randomly or evenly spaced. The nail plate may appear as if it has been filed with a coarse abrasive, or the free edge may be ragged, or there may be symptoms of both. And then lastly on this slide, we have nail pterygium. The P is silent, so that is nail pterygium. And that is characterized by the abnormal stretching of the eponychium or the hyponychium surrounding the nail plate. This usually occurs from serious injury or an allergic skin reaction. Creams or conditioning oils may be helpful. However, never attempt to push back or treat pterygium with any type of instrument because you are going to do more damage than good. Next, we have onychophagy. Onychophagy is basically bitten nails, nail biting. Frequent manicures and proper care of the hands can often help to overcome this habit. You can remember onychophagy and what it means because the word chop is right in the middle of that word. Okay, so again, onychophagy is nail biting or bitten nails. In the middle top, we have onychorexis. So onychorexis is characterized by abnormal split or brittle nails appearing as surface roughness on the nail plate. Potential causes are heredity, injury to the matrix, possibly excessive exposure to cuticle removers, harsh cleaning agents, or aggressive filing techniques. And then over to the right, we have pincer nails, or sometimes you can also call them trumpet nails. They are characterized by a form of dramatically increased nail curvature at the free edge. The nail can curl in upon itself or may be deformed only on one side wall. Extreme or unusual cases or painful conditions must be referred to a doctor. Using a brace type product to straighten these nails is a medical practice and cannot be performed in a salon. The bottom left is what we call a plicature nail, and it's also known as a folded nail. So I will add that to my notes. A plicature or folded nail is a highly curved nail plate, often caused by injury to the matrix, which may be inherited. Plicature nails often lead to ingrown nails. Then we have ridge nails in the middle bottom. Those are lengthwise grooves in the nail plate, often mistaken for ridges, and it's seen in normal nail aging, so it's nothing to be alarmed about here. And then we have splinter hemorrhages on the bottom right. And what happens here is there's been damage to the capillaries under the nail. It gives the appearance of a lengthwise small splinter underneath the nail plate. This is usually caused by physical trauma or injury to the nail bed. Maybe your client or you, again, hit your nail, maybe bent the free edge backward and caused a splinter hemorrhage. So it's basically like a small spillage of blood or like a really small blood clot. Those will grow out as well. Okay, so nail infection. So proper cleaning and disinfection reduces the risk of spreading nail infections from client to client. Never take shortcuts for cleaning and disinfecting procedures. Ever, ever, ever. If you repeatedly encounter nail infections on your client's nails, you should re-examine your cleaning, disinfection, preparation, and application techniques. Remember to always mix your disinfectants according to the manufacturer's instructions. And implements and single-use items should be used on one client and one client only. And then lastly, you always want to use a clean towel for each service, and be sure to clean the table surface before and after each procedure. Now we're going to get into diseases of the nails, and there are 9 of them. So you may come across any of the several nail diseases in any salon. Any nail condition or disease that shows sign of infection or inflammation, such as broken skin, redness, pain, swelling, or pus, should not be diagnosed or treated in the salon. You should never provide any service of nails, any type of nail services to clients with a nail infection. So our first disease is onycholysis, and it's characterized by the separation of the nail plate and the nail bed. So the nail plate and nail bed, they become separated from each other, and it's often due to injury or an allergic reaction. When the cause is removed, the area will slowly begin to heal. For this particular condition, medical referral is required. On the right, we have onychocryptosis. Um, Simply put, these are just ingrown toenails. Okay, so ingrown nails can happen either on the hands or the feet, wherein the nail grows into the size of the tissue around the nail. Medical referral is required. As a nail technician, you should not remove ingrown toenails or nails because that is not within your scope. Next, we have onychomatosis, which is what you see on the left-hand side. Onychomadesis is the separation and falling off of a nail plate from the nail bed in either the fingernails or the toenails. It's caused by infection, injury to the matrix, a systemic illness, or a medical procedure such as chemotherapy. Medical referral is required for onychomadesis. And so, again, that's the separation and falling off of the nail plate from the nail bed. Next, we have onychomycosis, which is a fungal infection. So make sure that you write that down. It's a fungal infection of the nail plate. It consists of a whitish patches that can be scraped off of the surface of the nail or as a long whitish or pale yellow streak within the nail plate. A third common form causes the free edge of the nail to crumble and may even affect the entire nail plate. This often invades the free edge and spreads towards the matrix. Medical referral is required, and I'm going to just also say that this picture that Milady provides for onychomycosis is not the best picture, so I do encourage you to go put a pause in this video to go look up another picture of onychomycosis because it is a fungal infection. And then next on this slide and last on this slide is what we call onychosis, or we may also call it onychia. And it's just an inflammation of the matrix and shedding of the nail plate caused by infection or injury. Possible medical referral is required. And again, I also encourage you to go and look up a picture of onychosis or onychia. Next, we have paronychia. Paronychia is the bacterial inflammation of the tissues around the nail plate, causing pus, swelling, and redness. This is often seen in dry or chapped hands from excessive exposure to water or detergents. Medical referral is required, and again, I do encourage you to go and look up various pictures of paronychia. That way you can have a better understanding because the pictures that are provided in the textbook may be a little bit off-putting. We also have what they call Pseudomonas aeruginosa, and this one is very serious. This is the rapidly growing and contagious bacteria that can cause an infection. Seen in the early stages as a yellow-green spot that becomes darker as it advances in stages, changing from a yellow to a green, then to a brown, then to a black. Medical referral is required for this particular disease. And then we have pyogenic granuloma, which is a severe inflammation of the nail in which a lump of red tissue grows up from the nail bed to the nail plate. Medical referral is required in this condition as well. And lastly, we have tinea pedis, which is what we call athlete's foot. Anytime you see tinea, you need to understand that fungus is associated with it. This is the medical term for fungal infections of the feet or athlete's foot. It is seen as red patches or scaling on the skin, on the bottom of the feet, and or between the toes, okay? This can spread by dirty tools and equipment. Medical referral is required. So these are all of the diseases of the nail that you may see or come across in the salon. A variety of nail infections develop more rapidly in people whose occupation requires them to replace their hands in harsh cleaning solutions. Natural oils are removed from the surface of the skin by frequently exposure to soap, solvents, and many other substances. So the nail technician's hands are exposed daily to professional products. And just remember to always use your products according to the manufacturer's instructions to ensure that you are using them safely. Nitrile gloves are recommended and are less likely to cause an allergic reaction than latex or rubber gloves. Always make sure that you keep an SDS or a safety data sheet for all of the chemicals that you use in the salon, and everything that you do before, during, and after salon services is to reduce the risk of infection and injury to your clients. This is why it's important to properly clean and disinfect your tools and equipments, as well as not to work on unhealthy conditions or infected skin or nails. Intact, healthy skin is an effective barrier to infection. Objective number 6, outline the scope of practice for your license related to nail structure, disorders, and diseases. Laws are set forth by legislature and determines the scope of practice for each license offered within the state. Laws or statutes also set guidelines for regulatory agencies and boards to make rules. Nail technicians are governed under cosmetology, so you will find the definition of nail technology under cosmetology laws. The definition of each license clearly states what can be done with that license, and those are the only practices that are permitted within the state. There is a clause in cosmetology law that states that unless otherwise licensed, no one licensed under cosmetology, including nail technicians, can perform any act listed in any other license definition in that state, meaning that if a procedure or practice is listed under any medical license or podiatry license, it is prohibited by a nail technician. That is all 6 objectives of Chapter 4. So we covered how nails originate in the epidermal layer of the skin. The condition of the nails is dependent upon the individual's overall health. You must know when it is safe to work on a client, and you need to be able to identify unhealthy conditions that must be referred to a physician. I hope that this has been a great day or moment of learning for you. If you have questions, be sure to leave us a comment below, and we'll try our best to assist you as best we can. Have a great day and good luck.